Okay, welcome. And today I have with me Merita. Merita, can you tell us a little bit about yourself?
So I'm Merita. I am a nurse practitioner. I work at Kuku Medical Center. I work in a couple of different roles. So I work in the clinic. So I do see patients on a regular, like every couple of weeks. I'm in there. Then I also work as a hospitalist on the inpatient side, which is what we have. We have like what we call a critical access hospital here in Kuku because we're so far away from any other real big hospital for like about 25 miles. So I do what we call SNF care or skilled nursing facility type of care here, where we take care of patients that have like long-term antibiotics and physical therapy, occupational therapy if they're recovering from a long-term hospital stay. I also still work as a RN in the ER.
Yes.
And her head Kuku Nasaido, Amy, Dr. Amy. I've been a nurse for approximately 23 years now, or 24 years actually, 24
Nice.
years now. And I've worked in a couple of roles as a nurse. I've done obviously med surge, I've done telemetry, which is just like a lot of cardiac monitoring. I've been a house supervisor. I've worked a little bit of
Cool.
behavior health, and I've done mother and baby, which is I like that part because it's just so cute to play with the babies.
Yeah.
But my last role as an RN basically is in the ER, and I love that, and that's why I still stay in the ER. And
Awesome. So you are the perfect person to talk about our topic today. So we're going to talk about whether someone should go to, say, their doctor's office, the urgent care, or the emergency room based on their symptoms. Your clinic is sort of more like a doctor's office, or is it more like an urgent care? Do you do
more like a
appointments?
doctor's office. So you have your own panel. You see patients with chronic conditions like your diabetes or hypertension, that type of thing. Then I also like see a lot like more like urgent stuff, urgent care, like coughs, colds, ear infections are huge. We see a lot of those.
So, what should people ask themselves when they feel sick or are having some kind of symptom and they're contemplating, should I go to urgent care or should I go to the emergency room? What do you think are some of the things that people should consider?
Obviously, like if you are short of breath, you feel short of breath, or you're having any chest pains, that's nothing to like people are like, oh, but it's a little bit of chest pain. But any type of chest pain, I just tell my family even because they're always calling me with their chest pain problems. The breath,
Great
the doctor
advice.
are. That is where you want to go. You don't want to wait on that because that could be something serious, and you don't want, and like basically, time is money when it comes to your heart or your brain. You
Mhm.
don't want to deal with any of that. So I'm like, straight away, just go to the ER. It might be nothing, and that's okay because now you've got peace of mind. But if it is something, you're in the right place to get treatment straight away. Because if you go to your doctor's office, they're basically just going to send you right to the ER, especially when you say you're having chest pain. You
Mhm.
might do like a few things, like look at your EKG, but that's just pretty minor. Not every doctor's office will have an EKG. Not every doctor's office is able to do labs straight away and get them done straight away. Most of the time, they don't. So if you're having chest pain or you're short of breath, please just go to the ER.
Urgent cares and clinics are limited in the things that they can do,
Yeah.
right?
And even some urgent cares will not even be able to give you an x-ray if their x-ray tech is not there at that time. I've gone to an urgent care because I was thinking to myself, oh, my child, like for example, my daughter, she had injured her finger. And so I was like, this is not really an ER visit. You're pretty stable,
Mhm.
but you still got pain and that finger looks a little weird, even though your uncle put it back in place. So it's like, let's just go to an urgent care because urgent cares have x-rays. So we went to the urgent care and they didn't have an x-ray. So I was like, go to the ER instead. Yes, you should call before you go to make sure that they have the services that you feel like you're going to need.
And typical hours, what would you say typical hours for an urgent care would be, like business hours?
They're mostly business hours, except on Saturdays, they do close early. Don't forget cost. Cost is really important.
So, what is your advice about cost?
Obviously, with the ER, those are things that you should be expecting that you're going to pay 10 times the amount that you would if you went to the doctor's office. Your copay at the doctor's office, depending on your insurance and what plan you're on, is generally only about like $20, $25. Urgent care is going to cost a little bit more, obviously, and they generally want you to pay when you're there, like after your service or before your service even. And ER will bill you, but sometimes they will make you pay prior to having any of the services. Cost wise, obviously ER is going to be like up here. It's the highest costing one. So it's like around 10 times the amount that you might pay at your doctor's office. And then you've got your urgent care, it's like in the middle, depending on your services. And that one is service based most of the time. It's service based. Like if you're having x-rays done or you're having labs done, or if they have to call in for something else, that's like service based, obviously.
So they pay, service based means pay per test.
Yeah,
Is that what that means?
Yeah. And it's not just one test. Like say they order you like one type of blood test, but then they want another blood test. So you're paying for each one of those blood tests. Which is what you would do also, I mean, with your clinic your clinic and with ER, but it's on ER is obviously always going to be 10 times more. And then with your clinic, or if you're seeing your provider, they already have like a base amount that your insurance will pay, and then that's it. And then they shouldn't filter that towards you. You're just going to pay your copay as long as you're in managed care. So you go to the one that your insurance will pay for.
Okay. So what if a patient doesn't have insurance?
So that's twofold. So if they are an American citizen and they live here in Hawaii, and this is their primary base, they can apply for what we call Quest, which is our Medicare, Medicaid that we have in Hawaii. Hawaii is one of the better states when it comes to insurance. And if you are from here, you have a low income, your ER will automatically start the paperwork for you, which is perfect. And they want you to make sure that you complete the paperwork within the next 24 hours so that you won't get the bill for it. Your urgent care, I'm not sure how they do that, but I'm assuming that they will also start the paperwork. I know our ER starts the paperwork for our patients like that. And then our clinic that I work at will start the paperwork as well for patients like that.
What I want to say about that is that I understand that people don't want to pay out of pocket, even if it's $50. Sometimes they don't have $50, which I understand. But using the ER for something that could be taken care of at urgent care just makes the ER waits longer. It overwhelms the system. I highly recommend not doing that, if at all possible. I understand that there's things to consider. But we do see a lot of things at the ER that could definitely be taken care of at an urgent care. We're going to play a game called ER or urgent care. I am going to tell Merita a symptom or a multiple symptoms, and she is going to give her best guess or answer as to where the patient should go. So ready? You said chest pain already. Chest pain is always
ER.
ER. Very good. Okay. What if I pass out?
Oh, ER. Because that's a single event, or what we call a single event, where your brain has lost oxygen. So you should always go to the ER.
Okay, great. What about, oh, my ear hurts?
That one can wait. You can go to urgent care or make it an appointment with your clinic.
It hurts when I pee.
Urgent care.
What about a severe allergic reaction?
Oh, ER. Yeah.
What about rash without an allergic reaction?
Urgent care or your clinic.
What about flu-like symptoms? Nausea, vomiting?
Urgent care, because they can do the testing there.
What about a sunburn?
Urgent care.
What about vaginal bleeding when you're pregnant?
I'll go to the ER.
Good. What about like a simple laceration? I cut my finger on a knife.
Urgent care.
And what about I cut my finger on a knife and blood is spurting out?
I'd go to an ER.
What about neurological symptoms like my face is droopy or I'm slurring my words? What would that be?
That is emergent, called EMS ER.
Right. So that would be like stroke.
This is stroke symptoms.
What about someone in my family is really confused? They're not making sense, um, I can't wake them up.
I would go to the ER, call emergency services. I need to go to the ER.
Very good. What about if I fell down, but I got back up?
If you got back up, urgent care.
What about if I fall down and I can't get back up?
I would go to ER.
Okay, what about if you get in a car accident?
I go to the ER, in all honesty. I go to the ER.
If I've been nauseous and vomiting all day?
I go to the urgent care. I think also like it depends on how long you've been vomiting and like how much you've been vomiting. If it's all day and also if you've not taken anything and you can't keep anything down. If you can't keep anything down, you've been vomiting copious amounts for a long period of time, go to the ER because you're gonna need fluids.
Go, especially if you're dizzy, right? You get up and you feel dizzy, right?
Right.
Good. What about a serious burn? Like it's blistering or I don't know, something blew up in your face.
Oh, go to the ER for sure.
Definitely. We worry about airway.
Yeah.
Sorry, what about a head injury? Your kid like fell off the couch and bumped their head.
How are they acting afterwards?
Fine.
Then just the urgent care probably.
So when would you want to take a child with a head injury to the ER?
When they are not acting themselves, like, and you know how they act, how your children act when they're just normal and they're more rambunctious and stuff. But if they're slowed down in their actions, they just are a lot more sleepier or copious amounts of vomiting, not just a small amount, but a lot of vomiting, I go to an ER for sure. And also mechanism, like how far did they fall? Like, and how big are they in relation to like how far they fell?
How about if my eye is red and itchy?
Well, urgent care.
What about if I got something poked in my eye?
Oh, ER for sure.
Good. What about chronic pain? Like I've had knee pain for 3 weeks.
Urgent care. You should have gone to your PCP.
We know that it's sometimes difficult to get a doctor's appointment, right?
Yes.
But typically, if you're going to go see a doctor for something, it'll be minor, right? Like cold, flu,
Okay.
ear
Regular
pain, something like that, right? So if you can't get an appointment with your doctor and it's something minor, it's very appropriate to go to urgent care, right?
Yes.
Okay, Merita, thank you so much for joining me today and giving us a little insight, a little of your expertise about urgent care, doctor's office, or ER. Thank you so much.
Thanks for having me.